This video is a video you want to watch if you're looking for cardiac pharmacology for the NCLEX. These are medications that shows up on the NCLEX. There's 24 of them. In order to make it easy, I try to give you some clue, the most tested cardiac medication in the very straightforward, easy way to remember this. So the first one is this. This medication is used in CHF. It's also a potassium sparing. You should avoid salt substitute. Does it ring a bell to you? This is the second one. It's used for hypertensive crisis. The medication is very light sensitive. So you stay away from, you make sure you keep it away from light. It can drop your blood pressure so quickly. This medication, you got to take it at night. But what you need to do, check as a nursing priority, what? Check the liver function and then look for muscle pain. If you see that, you need to stop the medication. These are buzzwords. The NCLEX is going to ask you. These are medications that shows up multiple times on the NCLEX. Easy way to remember that. And the fourth one, if you have arrhythmia, we can use this medication. It can cause AV nodal block, so heart block. It can lead to shortness of breath and progressive dry cough. Does it ring a bell? 4 medications. Which one do you think is a cardiac medication? I'm just giving you a clue. What do you think? If you know, you put down your answer and I will go over it. These are your options, right? Medication used for CHF is a potassium sparing. You should avoid salt substitute because what? Because it's hyperkalemia. Salt substitute is a bunch of potassium, so you should avoid it. This medication is used for hypertensive crisis. Which of this, if you have hypertensive crisis, you would choose? But guess what? That medication should be light sensitive and it can drop your blood pressure quickly. Once again, you take this medication at night, you should watch for muscle pain, priority, right? This is what NCLEX is going to give you. And then you monitor your liver function. If you take this medication, you're going to have shortness of breath and progressive dry cough. But we use it for what? Arrhythmia. It can cause heart block. What do you think? This is the easy way to remember cardiac medication. So let's look at it. First medication. I have to pick something for CHF, and that medication should increase my potassium. That's why I should avoid salt substitute. Look at this medication. This is atorvastatin. Does it do that? This is Spironolactone, right? And this is Nitroprusside, Amiodarone, Hydrochlorothiazide, Rosuvastatin. I see potassium sparing Spironolactone. It's right there. It's just potassium sparing. I should avoid what? Cardiac salt substitute, and we can use it in CHF. So that's number 1. Number 2, this medication is very good for hypertensive crisis. It's also very sensitive to light. So you keep it away from light and it can drop your blood pressure, right? Hydrochlorothiazide is not used for hypertensive crisis, so it's gone, right? Atorvastatin is not used. This is the medication, Nitroprusside. It's sensitive to light, but it's very good in hypertensive urgency. You take this medication at night, and the priority function is what? Muscle pain. What do you think? If you remember this medication, these are buzzwords. This is what they will put in the answer choice, in the case study or anything like that. Priority, nursing function. I take it at night, monitor liver function and muscle pain. If you know this, you know that medication. What do you think? This is consistent with what? Atorvastatin. It's a statin medication, and that's the side effect to teach the patient and what to monitor for. One line, it has everything you need to know about statin. That you take it at night because you make cholesterol at night, and then you monitor liver function because you affect the liver. Your priority function is what? Muscle pain. That's what you worry about. The medication can be used for arrhythmia. Which one? Is it Amiodarone or Rosuvastatin? But what? Progressive cough and what? Shortness of breath. I call it PCLON, pulmonary fibrosis, pulmonary fibrosis, pulmonary fibrosis, and that is Amiodarone. Amiodarone is used for arrhythmia because it's heart block, and this is your priority nursing function. These buzzwords I call them buzzwords. When you know them, you know the medication. You don't have to think about anything. Arrhythmia, AV block, and what? Progressive and cough is amiodarone. If you watch this video multiple times, you will know every cardiac medication. Just one video, it has all the cardiac medication you need to know in the very straightforward. Therefore, this is amiodarone, and that is the way you should be able to analyze these questions. So that's the first group of medication, for medication in a simple way. Next one. To take this medication, you got to check your pulse, apical pulse, right? It can cause halos in your eyes, right? And it can cause bradycardia. Does that ring a bell? At least it's a clue. Bradycardia causes halos around your eyes, and you should check apical pulse. These three words, I call them buzzwords, should give you a clue without me even giving you the answer. For this medication, you got to hold it when your heart rate is less than 60. If you have hypoglycemia, you won't be able to know it. Therefore, if you have diabetes, you should be careful. If you have asthma too, we should be careful not to take it, right? Cautioning asthma patient. This medication is taken sublingually, so you put it under your tongue. It can cause headache and hypotension. Does it ring the bell? For this medication, you got to monitor what? INR and PT. You should be consistent with your vitamin K rich food, right? And then you should avoid it in pregnancy. Does that give you a clue? I know you know it because you watch adapting this. For medication, I don't give you the name of the medication. I just give you clues for you to be able to remember them. And this is the way to master cardiac medication. You have a bunch of them. You have Propranolol, you have Nitroglycerin, you have Digoxin, you have Nitroprusside, you have Warfarin, you have Rovaroxaban, you have Dobutamine and enoxaparin. Which medication you should check your apical pulse? It can cause halos and causes bradycardia. All of them, what do you think? This is consistent with what? Digoxin. This is everything you need to know about Digoxin. You should hold this medication if your heart rate is less than 60. If you have diabetes, you shouldn't take it because it can max hypoglycemia. If you have asthma, you should stay away from it because it can cause bronchospasm. Which medication? Is it Warfarin? Is it Nitroprusside? Is it Nitroglycerin? Is it Propranolol? Is it Rovaroxaban, Dobutamine, or what? Enoxaparin. These are all marks of what? A beta blocker. Beta blocker, and you have the law there is Propranolol. This is your answer. I'm telling you, this is the easy way I can give you this cardiac medication in the easiest form. Well, it's sublingual, right? Causes hypertension and then what? Headache. There's two medications that causes hypertension and headache. They are all nitrate, right? Nitroglycerin and Nitroprusside. But it's only nitroglycerin that you take it sublingually. Therefore, this is that one. And the last one, everybody know, you should check your PT&INR, right? And you should, if you eat vitamin K dependent food, it has to be consistent. No high or low, consistent amount. And you should avoid it when you're pregnant. What is that? Warfarin. Did you get it? 8 medication so far. And I know you're seeing the clue I'm giving you. These are cardiac medication, most tested cardiac medication, drug for the NCLEX, and they are clue, including the buzzwords, the side effect, and need to know in case you see a question. The next group is number 9, right? We can use it to treat what? Stroke. After stroke, it causes bleeding. If you have surgery, you should stop it. It can also cause dry cough. That's another medication. It causes hyperkalemia. It causes angioedema. Does that give you a clue? This medication is used for hypertension. You should monitor for what? Muscle cramps. The next medication, if you have angina, we can give it to you. You should put it on in the morning and take it off in the evening. For medication. I'm not giving you the answer, but think about it. If you're able to recognize this clue, you already know the medication. Don't bother yourself anymore reading too much about it. If you can identify 9, 10, 11, and 12 without me giving you possible answers, that means you know it. And at least there's one of them you should be able to figure it out, right? You can use it to treat stroke. It causes bleeding, and you should stop it for what? Surgery. At least it has to be some form of anticoagulation, antiplatelet problem, right? So these are your options. You know, enalapril, hydrochlorothiazide, clopidogrel, nitroprusside, nitroglycerin, patch, or losartan. If you have stroke, well, antiplatelet or anticoagulation. And therefore, this is clopidogrel. If you don't know it, this is the medication you can use, clopidogrel. This medication causes cough, hyperkalemia, angioedema. What do you think? What do you think? Which medication among all those I've given you, it can cause dry cough, it causes hyperkalemia, and angioedema? What do you think? Right? Another one is used for hypertension, and you should monitor your muscle cramp. It can be used for angina. You should apply it in the morning and take it off in the evening. This is obvious because it's angina prophylaxis is a nitroglycerin patch. But then hypertension and muscle cramp, that means that medication will decrease your blood pressure and can cause muscle cramp. The most common one is something that causes hypokalemia. Which medication here causes hypokalemia? That is hydrochlorothiazide. So this is hydrochlorothiazide. Causes hypertension and causes muscle cramp. Which medication can cause angioedema, hyperkalemia, and dry cough? You have ACE inhibitor and ARB. You know, ARB does not cause cough and angioedema. Therefore, this has to be the enalapril. 12 medication. You get the clue. So these are little things I want you to pay attention to. I call them the buzzword for the cardiac medication to be able to recognize them, right? And this is the next one. Next group. Well, it doesn't cause cough, but it can cause peak wave, T wave, right? It's also teratogenic. That means you should not take it if you're pregnant. It's a diuretic. It causes autotoxicity, right? You should give it slowly if you're giving it through IV, and it can cause Stevens-Johnson syndrome. Does it give you a clue? This is an anticoagulant, therefore it causes bleeding. You don't need lab work. And what is this antidote? Andexanet Alfa. Andexanet Alfa. That is the antidote. And the last one, it lowers your blood pressure, your heart rate. It can cause bradycardia, and you should know no grapefruit juice. Something should be ringing in your ear. That's the buzzword. Most tested cardiac drug for the NCLEX. Buzzword should be ringing. These are the buzzwords. Common side effects. Need to know. Prioritization. And that's the medication. Enalapril, hydrochlorothiazide, furosemide, nitroprusside, and all of them in front of you. Which one? No cough, but it causes peak T wave. This is telling you peak T wave. Instead of me giving you hyperkalemia, I give you peak T wave. So this is potassium is too high. And it's also teratogenic, right? It cannot be ACE inhibitor because ACE inhibitor causes cough. It causes hyperkalemia. Which medication causes hyperkalemia? You have valsartan right here. It causes hyperkalemia and it's also teratogenic. It does not cause cough, so it can be ACE inhibitor. So this one. This one is a diuretic. It causes hearing problem and giving slowly, and then IV-wise, and then Stevens-Johnson syndrome. There's diuretic here, hydrochlorothiazide, but it doesn't cause autotoxicity, right? The most common one is furosemide, right? That causes autotoxicity if you give it too fast. So you have to give it slowly through IV. And it's a sulfur drug. So it causes Stevens-Johnson syndrome. Even though hydrochlorothiazide can do the same thing, it doesn't follow this pattern. These are anticoagulants. You don't need the lab work. And this is a Andexanet Alfa. So you look at it, you see there's a warfarin here. Warfarin, you need lab work. So this is eliminated. Apixaban, rivaroxaban, anticoagulant, you don't need lab work. And the antidote is Andexanet Alfa. These are direct factor 10 inhibitors. These are medication you have to know. These are buzzwords they put in selector apply. These are trappy things they ask you. No, it's an anticoagulant, no lab work, and that's the anti. You don't need to change your diet, anything like that. So this group go here. And of course, something that is going to lower your blood pressure and lower your heart rate, and then no grapefruit juice is consistent with the calcium channel blocker. Do you see calcium channel blockers there? Yeah, the verapamil and the thiazide. So this one go here like that. For cardiac medication, most tested for you to be able to master them in the simple, straightforward, buzzword way. So these are the last few ones are coming. One is used for heart failure and shock too. It's a beta agonist. It can increase your cardiac output. So it's an ionotrope, right? As you monitor your PTT and your platelet, and I can give you protamine sulfate if you're bleeding. Does that ring a bell? It causes peripheral edema and headache, but no grapefruit juice. You should stop grapefruit juice. And then it can cause hypokalemia. At the same time, it can raise your sugar, hyperglycemia, and your uric acid, hyperuricemia. These are the medication, the same medication. Something that is used for heart failure and shock and ionotrope is dobutamine. That's the one. I call them the triple Ds. So the 3 Ds are digoxin, dobutamine, and dopamine. One of this is dobutamine. So this one go here. Monitoring your PTT and platelet is heparin function. That's number one, right? And the antidote is protamine sulfate. It's not enoxaparin, even though it's a form of heparin. So this is the regular heparin. And this causes peripheral edema, headache, and grapefruit juice. This is the same thing as calcium channel blockers. Calcium channel blockers are vasodilated, so they causes peripheral edema, headache, and you should avoid grapefruit juice because of the liver function. And therefore, this is one of them, amlodipine. And this medication will decrease your potassium, but it can increase your sugar and uric acid. Which of these two diuretics left do you think? There's 3 diuretics there. Which of them belong to number 20? Tell me, pick an answer. What do you think? Which one will cause hypokalemia, raise your blood sugar, and uric acid? What do you think? This is the tricky one. So I'm going to cause hypoglycemia. Your sugar is going to go up and uric acid goes up. This is no furosemide. It doesn't do that. It can cause hypokalemia, but it doesn't raise your sugar or uric acid. These are thiazide features, and that will be hydrochlorothiazide. And another thiazide is what? Clopidogrel. So these two would do that. Hydrochlorothiazide and clopidogrel. 2 medication that you should know. And the last one, last group of medication that you should be careful about. It's used for hypertension. It blocks renin directly. It causes hyperkalemia. It looks like ACE inhibitor. It looks like an ARB. It also causes angioedema. But remember, it blocks renin directly. This one is aldosterone antagonist. Therefore, it blocks aldosterone. It leads to PT wave, and you should avoid salt substitute. And this one is ionotrope for heart failure. Use it short term in an IV form. It can cause your blood pressure to drop. And then this medication is used for hypertension and BPH. So if you have both of them, we can give you both of them. and it causes orthostatic hypotension. Therefore, you should take it at night. 4, clue. 4, buzzword. 4, priority. 4, side effect. 4, need to know information about this medication. Which one belongs to who? Hypertension, BPH, because it's hypotension. What do you think? Inotrope, severe heart failure. You give it IV in the short term, it causes hypertension. This one is going to block what? Aldosterone. It causes peak T wave, and you should avoid salt substitute. This one is used for hypertension. It blocks renin directly and causes hyperkalemia. It look like ACE inhibitor. So it look like ACE, but it's not ACE inhibitor. Angiotensin receptor and blockage, ARB and angiotensin enzymes, they behave the same way. This one, it was blocking renin, and that is this medication, Lasix. Lasix is a new medication that blocks renin. If I have peak T wave, that means that causes hyperkalemia. That's why I should avoid salt substitute, and I'm blocking aldosterone. That's this one. Yeah, I know everybody knows spironolactone, but don't forget this one. This is also the Propranolol. The NCLEX can give you that. That is a potassium sparing. It looks like spironolactone. You do the same thing like spironolactone. You block aldosterone, lead to hyperkalemia, therefore peak T wave, and therefore you should avoid salt substitute. As an inotrope, you use it in heart failure, but you give it IV, causes hypotension. Most inotropes does not cause hypotension. Therefore, it cannot be dobutamine, right? Dobutamine is inotrope, but it does not cause hypotension. The inotrope that causes hypotension is Spironolactone, and this is used in heart failure. Now, you have to give it through IV in a very short term. The medication that can be used if you have BPH and hypertension is the guys, I call them the Zosins, the Zazozins. If you have BPH hypertension, these are medication you take. It causes orthostatic hypertension. Therefore, you should take it at night. 24 medication. NCLEX most tested cardiac drugs. Clues that you need to know. Buzzwords, side effects, need to know information. Easy way to present cardiac medication in less than 30 minutes. I hope you understand them. Good luck in your exams. If you like this video, you can click on the like button, put a comment if you want me to comment on it, some medication that is trapping you. But take care of yourself and good luck.